Hello, everyone. My name is Sarah Kirk, and I'm an epidemiologist with the Healthcare Associated Infections Program at the Colorado Department of Public Health and Environment. Our team has made this presentation on glucometer and blood glucose testing safety to help bridge some of the common gaps that we see while we're in the field. This presentation will go over the basics of blood glucose testing and the associated risks, the common gaps that we see in the field, the bottom line best practices for blood glucose testing, including the use of glucometers, lancets, and lancing devices, as well as insulin pens. We will have a note on FDA verification and manufacturer's instructions for use at the end of this presentation. We will also present some resources to assist with training and education of these care activities. According to the CDC, over 30 million Americans have diabetes. Blood glucose testing is critical for the management of diabetes and is performed in a variety of healthcare settings to ensure optimal care is provided given the diabetes-related health complications for these patients. This management extends far beyond that of the primary doctor or health care facility in which the patient is admitted. It can include dental offices, pharmacies, and health fairs. Although these tests are commonly performed in a variety of settings and for many a routine part of care activities, training and knowledge of their associated risks are often overlooked. Blood glucose testing includes specialized equipment such as a glucometer, lancet or lancing device, and often the administration of insulin. Improper use of these items can put patients at risk for exposure to bloodborne pathogens. There is an underappreciated risk of blood exposures associated with blood glucose testing due to the opportunity for exposure to bloodborne pathogens and unsafe practices often being overlooked. And this can include contaminated equipment and supplies, the sharing of blood glucose meters, fingerstick devices, and/or insulin pens, and failure to perform glove change and hand hygiene in between blood glucose testing on multiple patients. This slide shows a lancet, insulin pen, and glucometer being used on a patient with a pathogen. Just a reminder that a glucometer or blood glucose meter is used to test a person's blood glucose concentration or their blood sugar. Lancets prick the finger of the patient to obtain a drop of blood, which is then placed on a test strip and inserted into the glucometer. Depending on the patient's blood sugar level, insulin may then be administered via injection with a needle and syringe or a pre-dosed insulin pen. All of these devices do come into contact with a patient's blood. So if these devices are used on a patient with a bloodborne pathogen and then improperly used on another patient, the second patient can become infected with a pathogen by indirect contact. Bloodborne pathogens of concern are hepatitis B, hepatitis C, and HIV. However, most outbreaks are associated with hepatitis B and hepatitis C given their ability to persist in the environment. What we are worried about through indirect and transmission of pathogens when it comes to blood glucose testing, these are our three main pathogens of concern. The problem with hepatitis B and hepatitis C is they are very highly infectious. However, they usually can survive in the environment for up to 1 week or longer. However, HIV, while it is highly infectious, it does not survive as well in the environment. The sharing of blood glucose testing supplies, improperly disinfecting glucometers, and using glucometers meant for one patient on multiple patients all put patients at risk of exposure to bloodborne pathogens. At least 18 outbreaks of hepatitis B documented since 1990, resulting in 147 patients acquiring hepatitis B. In 2009, there was an outbreak of 9 nursing home residents diagnosed with hepatitis B from a shared glucometer. And in 2010, there was another outbreak of hepatitis B in another nursing home associated with the sharing of reusable lancet devices. However, due to underreporting and underrecognition of acute infection, the number of outbreaks due to unsafe diabetes care practices are likely an underestimate. These are gaps that we commonly see in our visits to healthcare facilities that can put patients at risk. These include failure to follow the manufacturer's instructions for use, also known as IFUs, which can range from sharing glucometers that are intended for single patient use, improper cleaning and disinfection, sharing of fingerstick lancing devices, and drawing insulin from an insulin pen. The other gap that we commonly see is cross-contamination. So this is when glucometers, insulin pens, and/or lancing devices are stored with clean supplies. Stocked supply bins or carrying cases are traveling to patient room and care areas back and forth. And glucometers and testing supplies are transported in pockets or at the same time as clean supplies. Every device should have instructions for use. Here is one example of them. Cleaning and disinfection expectations are outlined for these devices, and any off label use is not permitted. If you observe any off label use of these specific devices, these are high level findings and should be immediately corrected. So let's dive into glucometers a little bit deeper. As we touched on earlier, glucometers are the devices that test a patient's blood glucose. So when a drop of the patient's blood is obtained, it's put on the test strip and put into the device. There is an enzyme called glucose oxidase on the test strip that reacts with the electrode inside the glucometer. This then produces a readout of the patient's blood glucose concentration. So there's blood both going into the device and onto the device. And a recent study was done that showed 30% of blood glucose meters were contaminated with blood. So, given that information on contamination of glucometers, it's crucial that these are being disinfected properly and per the IFU. This is true for both multi-patient and single-patient use glucometers. Just a note that not all glucometers are approved for multi-patient use. The manufacturer's instructions must allow for it and specify how the glucometer is to be properly cleaned and disinfected for safe sharing. If they do not provide such instructions or allows for the glucometer to be cleaned with water, a mild detergent, or alcohol, the glucometer may not be suitable for multi-patient use. So now going into lancets and lancing devices. Lancets can also be used for blood collection. Since these are single use and they are disposable, they are very ideal in healthcare settings. There are many types of lancets, with the most common being simple safety lancets and auto-disabling lancets. Whichever type of lancet is used, it must be immediately disposed of in the sharps container and never reused. Just like reusable lancing devices, they can become contaminated with blood. This is our single-use auto-disabling lancet. How it is used, it is spring-loaded that deploys at the push of a button and then automatically retracts once the device is released. Many of these do have a auto disabling feature, so they cannot be deployed again, which does prevent accidental reuse and needle stick injuries. Again, these are always single use and should never be used on multiple patients. When it comes to blood glucose testing, glucometers really do not act alone. Lancets and lancet devices are used to puncture the skin to collect a drop of blood for blood glucose testing. Reusable lancing devices are devices that resemble pens and come with a lancet that is able to be changed. These devices often come in home blood glucose testing kits. Since these devices are very hard to clean and have been linked to outbreaks of hepatitis B in the past, they must be dedicated to a single person. They are not approved for multi-patient use. If these are used in your setting, assure that they are labeled with the first and last name of the patient that they are dedicated to, and that the lancet is immediately discarded after use. Never store these devices with the lancet intact. Okay, and now we're moving into insulin pens. Insulin can be administered through a vial and syringe, but often patients do have devices called insulin pens. And these are reusable syringes filled with insulin that administer a specific dose to the patient. The needles of the insulin pen are disposable and must be removed and disposed of in the sharps container after use. A new needle is placed on the pen just before the next dose of insulin is administered. The insulin pen cartridge has a rubber septum just like a medication vial and should be disinfected with an alcohol wipe before use. Since insulin pens are essentially a syringe, they must never be used for more than one patient. These are our 60-second check flyers that are available as downloadable and printable PDFs on our website, and they will be linked on the resources slide at the end of the presentation. The bottom line here is to maintain written infection prevention policies and standardized procedures that are available to all healthcare professionals. These policies and procedures should be tailored to the care activities and the population served, accounting for specific job duties such as blood glucose testing. Please require all healthcare professionals to perform their job duties in accordance with the standardized procedures, which is following the same patterns and processes each time and these overall assist in achieving accuracy, efficiency, and continuity among team members. Based on the gaps that we commonly see in healthcare settings, we have developed these resources linked above. All of these resources will be available on our website on the CDPHE website. Thank you for listening.